Thank you very much, Raquel. Good morning. Can we change the presentation? There is another presentation. The fourth one, yes. Thank you. Okay, so I would like to make an introduction for Twitter by using the words from Howard Lux. He is an orthopedist in the United States, and he is one of the most important advocates of social media as to our profession. And he says that our actions, our endeavors, are centrifugal in nature. Our efforts extend from the center, which is us, and are meant for a global audience thirsty for healthcare knowledge, to learn from our experience and to have a better understanding of their healthcare-related issue. So social media can be imagined as a centrifugal, not a centripetal force. Now, there are a lot of discussion about how we can use social media and Twitter as healthcare professionals, whether we have problems regarding with our patients stalking us or making us inappropriate questions. But I think that there are some examples globally, such as the social media highway code from the Royal College of General Practitioners that really puts in a very simple way how a healthcare professional can behave, and it's a very beautiful document, a very simple and beautiful document with simple rules, and I really invite you everybody to read it. It's freely available on the website of the Royal College. And just to make a very simple example, they say that, for instance, we should recognize that the personal and the professional can always be separated, because if we take an example of the general practitioners that lived like 50 years ago, they are living now in rural areas, in small villages, and they not really putting a wall between, or they draw a line between their personal and their professional life. So a patient might knock their door and they can disturb them, or for instance, they can go down to the bar and have a coffee together. So social media can be seen in that way, under that perspective as well. But I also like what Mayo Clinic says, and this is the very, very simple policy that Mayo Clinic has for its employees. Don't lie, don't pry, don't cheat, can't delete, don't steal, don't reveal. So you have to behave like in real life. That's simple. Now, I would like you to talk very briefly, to make a very brief introduction on Twitter. Many of us have asked ourselves, how is it possible that such a short medium can have an impact on medical, scientific research and academic circles, and what can be said in 140 characters that may be of their interest? The truth is that thousands of healthcare professionals, researchers and academics use Twitter each day. So Twitter, as probably all of you know right now, is a microblogging service that enables users to send small public messages, the tweets. It's largely an open platform. Tweets are limited to 140 characters, so you have to be very precise and very brief. And to start using Twitter, you need only 5 to 10 minutes. Now, Twitter is not only online, it's not only on the web. It's integrated very well on our mobile devices, on our smartphones, on our tablets. So, for instance, here on the iPhone, you can install the Twitter application, and then you can use the Tweet app and start tweeting. The fact that it's very easily integrated with our mobile devices, it gives us the power to make comments and to react at any time we want. I see something and immediately I can right away make a comment to the world and to my followers. So, for instance, here I'm just browsing a page on Safari, and I hit the share button. There's Twitter. I go inside and I write a comment on the article that I just read on Safari, on my browser. And even photos. I mean, you can take photos from the conference, and please do take photos from WONCA World and share it to the world, making comments. You just have to press the share button again on the photos, and here's Twitter again, and you can make your own comments by using, for instance, for this conference, the WONCA 2013 hashtag. And I'm going to discuss about hashtags in a moment. But what is important? Let's see. First of all, you have to find your own audience. You are talking to the world, okay, but who is your main audience? Is it your colleagues, your peers, your patients? Because nobody will actually be interested if you had like an omelette or a glass of milk today, and this is not such an interesting comment by you. So you have to be very precise in the comments. You have to like have your own policy on the content that you are giving on Twitter. You can retweet and make comments. You can reply openly to others. There's nothing you can fear. Our own president, Michael Kidd, is going to have his own Twitter account. You can mention them. And of course, you can send private direct messages if you think that something is not appropriate to be said openly and seen by the public. So some good practices. Remember that that social media are centrifugal. So what does 2.0 means? Means content, that's 1.0, plus engagement. I would very much like this definition for 2.0. So you have to provide content, you have to say your own opinion about that, about whatever you see, but you also have to engage with others. So if you are a passive listener on Twitter, you won't have the real experience from it. You have to perhaps read posts, answer to people, comment on people, very openly, very friendly, and without any fear. Be precise, concise, and persistent. Choose one topic and follow that path. As I said to you, my omelette that of this morning won't help you. Won't be very interesting. There is a lot of noise on Twitter, that's true, but there are many ways of organizing information. Don't forget that it doesn't matter if you miss tweets. The most important messages are always retweeted, reposted by other users. So one way is to organize information are the hashtags. It's like following a thematic channel with tweets. If you search for a hashtag, then you are going to have a list of all the tweets containing that particular hashtag. So for instance, if we search for primary care on Twitter, we will get all these tweets from all these colleagues or anybody else who just wrote a post and just put the primary care hashtag. Here's a closer look so you can see that here we have at any post the primary care hashtag. But if this looks very complicated to you, there are very beautiful new ways to see the information. For instance, on your tablets, you can have Flipboard, and you can put a hashtag there, so you can browse hashtags like a newspaper in a very beautiful way and a very clear way. But also, there are directories of hashtags, like this project from Simpler, which groups all the healthcare-related hashtags, whether they are healthcare, disease-related, or conference-related. And speaking about conferences, I'm very happy to say to you that last night, at the first day of the opening of the conference, WONCA 2013 was at number 8 worldwide as a conference.